Hi everyone, I'm Heather Wen, a retired nurse practitioner and the founder and practitioner at Arizona Healing Alternatives. On this channel you'll find several videos, what I like to call aha moments, where we'll be discussing issues that impact your health. So whether you decide to use Western medicine, alternative medicine, or even a mix of both, I'm passionate about you knowing what your options are. Oh man, wow, I just have this, oh my goodness, we're taping. Oh, okay, well, just had a little bit of a headache here, so I thought today we would talk about what's causing it. What's causing this headache? Well, what types of headaches? Are there different types of headaches? And then what can we do about it? If you want to know more about headaches, stay tuned so we can get rid of yours. So there are many different types of headaches, and you've probably heard of some, and there are many different reasons for headaches. I think one of the most important takeaways in this video is it's important to know which type of headache you have, because there are some headaches that can be very serious. So let's go into the types, and this is certainly not going to be an extensive different types and things like that, but what I will do is I will put up some of the articles. There's a really good one because it showed pictures of where in the head and what type of headache it is. I will also post the links in the description part of this video so you can go directly to there as well. And obviously I'm not going to cover all of them, but let's just go over some of the most common ones. And so first of all, let's go with the most common one, which is most like the tension headaches. And regardless of what they say in the articles, I'll tell you what I see the most. Tension headaches oftentimes generate, because when someone's tense and stressed, they tend to do this. They tend to tighten, shorten up the neck, this sort of thing. And when that happens, it can be on the sides of the head. Sometimes it's temporal on the sides of the head. These sorts of areas where in fact it can just be from tension. Well, what we'll know, we'll go into what the treatments are with that. That particular one tends to do really well with relaxation, massage, this sort of thing, okay? But we'll go into treatments a little bit later. What about, there's all sorts of really fascinating headaches. Well, there can be, allergies can be a reason. Sinus headaches, and the sinus area in the front behind the eyes sometimes can go along with that. And those can be sinus headaches. Why does that happen? It happens because when the sinuses are swollen or inflamed, it puts pressure, and so you can have these sorts of headaches in that area too. You can also have headaches from substances, like what if you're trying to get off caffeine? Okay, caffeine tends to constrict blood vessels, so all of a sudden, if you go off caffeine, you get this flooding and excess fluid and that kind of stuff, and you can end up with that sort of headache. Or withdrawal from certain medications or pain medications. Let's say you've been taking medications for headaches or migraines or things like that, and you've been taking those for quite some time. What can happen is when you go off of them, you get what's called a rebound headache from them. So there can be that reason for headaches. There can be migraines. Migraines are a different category. They're more throbby. They can have other sorts of things with them, such as photophobia, which means, oh my gosh, you have to be in a dark room because the light really bothers you. Your vision can be blurred with that even. And then you can even have vomiting or nausea. These sorts of things are more migraine-y type of headaches. And they usually resolve with things like going into a dark room, this sort of thing, or with medications. But also there's some really odd ones like cluster headaches, which are like on one side of the head. And they can be very disturbing. It's very odd in that case. But what we also need to know is, okay, so with all these different types of headaches and things to do, I know, what do we do about them and how do we know which ones we have? Well, what I always tell people is we have to pay attention to the warning signs of headaches, right? Warning signs of headaches, a headache like you've never had before, mouth is drooping on one side, you could have numbness and things like this going on. You always have to get that checked out, even if it's a migraine, because sometimes those types of headaches can be associated, especially with slurred speech, but not necessarily, can be signs of a stroke. And those are 911 calls, folks, because those are headaches that are related to a vessel in the brain, something like that, that may be either bulging or may be leaking some blood, and that can be very serious. That's a stroke. Also, a category I didn't mention was What if you've been in an accident? Like my headache when I was 19 with that horrible accident was because I almost was ejected out of the car and my head cracked the windshield with it. That'll give you a headache, let me tell you. So there can be trauma reasons too for headaches. But why is it important to know what type of headache you have? Well, when it comes to different things that you can do about headaches, one of the first things, and I did do a video on the little tennis balls when I had that auto accident, and so you can take a look at that, which is, I think, a quick and easy headache relief technique. That tends to take care of mine. But tension headaches and stuff, well, let's see, does it go away with? And this is something too, to be able to tell whether something is really serious headache or not. Because a headache that's real serious, like stuck up, isn't going to go away with anything you try, and you don't want to wait that long either. But when it comes down to it, does something like massage take it away, or taking some deep breaths, or if it is a migraine, very important to get that diagnosed, because there are different diagnostic tests that can be done to really tell what type of migraine, to really hone in on how to treat that. And with that, does the dark room take care of it? Does decreased stimulation take care of it? Like I said, the tennis balls, when I was using, does medication take care of it on any level? And what are some other options too? There's alternative things. Many times headaches in Chinese medicine can have a liver focus to it, that are liver related. And so that being the case, and that doesn't mean, oh my gosh, you have liver damage, you need to get a liver transplant. What that means is that in this medicine is that it's offline. In that medicine, there's acupuncture, there's herbs that can help. There are different sort of supplements that naturopaths can help with that. For me, I'm going through the cause to find out, is there an emotional component to it? Is there an emotional component, a physical component? What sort of thing is causing this that we can get into? And so in applied kinesiology, or in total body modification, I chase it down to try to figure out what is causing it, and then going after the cause of it. Whatever way you decide to treat it, what's so important, and the takeaway is knowing what type you have, what's causing it, make sure it's not one of those danger headaches, and then seeking out different things that you can do to resolve it. Because even like physical therapy, or things to try to keep the neck, because I tend to do this, I tend to poke my neck out and do that a lot, and when I do that, that causes tension headaches and stuff. And for me, yay, it's the wonderful tennis balls that I mentioned in that video. But for you, got to figure out what it is, how to deal with it. I hope this information has been helpful to you. Please feel free to write any comments that you have for me. And now, oh my gosh, my headache's gone. Have a great day.